Welcome to another episode of MedSynapse podcast, where we explore groundbreaking insights and innovative approaches to healthcare. I'm your host, Hetvi Shah, and today we are delving into a critical topic, which is bridging the gap, the challenges, and the solution in breast cancer for underserved population. Joining us is a remarkable expert in this field, Dr. Sanjay Yadav, a distinguished breast oncoplastic surgeon with extensive experience in advancing breast and endocrine surgery. Doctor currently serves as an assistant professor and unit in charge at NSCV Medical College at Jabalpur, and he's deeply committed to enhancing healthcare in low resource settings through research, education, and innovative practices. So, welcome, Doctor, and it is an honor to have you with us today.
Afternoon. Thank you so much. Thank you.
So, Doctor, as an oncoplastic breast surgeon, you have undoubtedly encountered disparities in breast cancer care. So, could you share your perspective on the most pressing challenges faced by underserved population in accessing quality breast cancer care?
Yeah, right. So this is slightly underdeveloped part, and the most pressing challenges which we face specifically to breast cancer is lack of access to timely screening of the patients and limited awareness. These are two main challenges. Apart from that, obviously we have financial constraints, like due to which patients are not able to travel and come to us despite the treatment being totally free of cost at our center. So this further exacerbates the problem, especially in rural areas, right? So, and other problems are like many patients present in very advanced stage of disease. So obviously there is shortage of trained breast surgeons. That is for whole of India, I think. So these are the few pressing challenges as of now.
Yes, I think those are actually some critical barriers that you have highlighted. So, building on that only, Doctor, how does late-stage presentation in underserved populations impact surgical decision-making, treatment planning, breast cancer cases?
Yeah, so obviously late stage presentation significantly limits the treatment options, especially the surgery options. Patients will not be able to undergo breast conservation surgery, which is the standard of care in almost all the developed world and also the metro cities of India. So late stage presentation, we cannot offer breast conservation surgery to all patients, and most of them will undergo mastectomy. And second problem is that late stage presentation significantly decreases the chances of cure. So suppose a breast lump is of 2 centimeter size, less than 2 centimeter of size, that is early breast cancer, T1N0 tumor. So their chances of cure are more than 90-95%. But the same, if the size of the lump doubles, it becomes 4 centimeter, the chances of cures also drastically decrease. They become less than 70-80%. So that is the issue with late presentation.
So I think it is clear that actually early detection could greatly, impact and improve outcomes and options for patients also. So I think repetitive breast screening is also advisable if I'm not sure. So, Doctor, for breast cancer screening programs only, especially often in underutilized or in underdeserved areas, what strategies can healthcare professionals implement to increase participation and awareness in these regions?
Yeah, so breast cancer screening is like it is of two types. One is doing X-ray mammography annually, and second is by clinical examination alone. So most of the developed countries, they have implemented X-ray mammography. How in India, it will be very difficult to screen almost all of women through X-ray mammography. So the clinical screening programs, which are essentially early breast cancer detection programs, are equally effective. So we can achieve that by community engagement, like partner with local leaders and influencers in rural areas, and create culturally sensitive awareness campaigns. Second is we can do task shifting. So, like training the primary healthcare workers and Anganwadi workers in clinical breast examination. Like they can be trained to detect breast lump, and then those patients who have breast lump can be referred to a specialized unit. And obviously there can be subsidized programs, and most important is public education also, use of schools, colleges, social media and local events to spread awareness regarding early detection, because breast cancer in today's era is almost totally curable. It is if it is detected early, then the cure chances are very high. So that can make really a long lasting impact.
Yes, I think that is rightly mentioned by you also, that early detection does play a major role, especially in breast cancer. And I think empowering local communities also can make a transformative difference, right? So
Yeah.
now, doctor, in your experience, how can healthcare providers in resource-limited settings build effective multidisciplinary teams to optimize patient outcomes?
Yeah, so obviously all cancers are better managed by a multidisciplinary team which are dedicated towards the patient care. But it is more important for breast cancer because the treatment of breast cancer, that there are three pillars: surgery and chemotherapy and radiotherapy. So obviously you will require help of a surgeon, help of a radiation oncologist and medical oncologist. So in resource limited setting, building a team is very important. So we can achieve that by upskilling the generalist, like train general surgeons and general physicians for basic oncology care, train the nursing staff for basic oncology care and taking care of patients after chemotherapy. Then collaborative networks like partnership with larger institutions which are specialized in breast cancer care. And then another important point is developing protocols based on the local setting. And when I came here in central part of India in Jabalpur, so majority of patients used to be treated by mastectomy. So we involved the pathologist, radiologist, everyone, and we have started doing intraoperative margin assessment, sentinel lymph node biopsy by involving them. So the patient care has improved. Then third is innovation, low cost surgical innovations for low resource settings, like the core needle biopsy, which is done to detect the breast cancer. The cost of that device is around 4,000 to 5,000 Indian rupees, which majority of our patients could not afford. So we developed a very low cost core needle biopsy device with the cost of which is less than 100 rupees. So almost all patients can undergo core needle biopsy. So then there are for the sentinel lymph node biopsy, there are low cost dyes like fluorescein sodium dye and methylene blue dye, which can help in sentinel lymph node biopsy. So low cost innovation is also very important to achieve the optimal patient care even for underserved patients, so that we can offer the same standard of care that any patient will receive at a developed center.
Correct. I think collaboration is something that truly is key also in such, especially it plays a major role in this underserved populations also. So now, doctor, given the shortage of trained specialists in many underserved regions, what role can mentorship program and telemedicine play in empowering local healthcare professionals?
Yeah, so like this is very important to create awareness and early detection. Like organizing regular community-based screening camps, and leverage the local network to educate people about the importance of early diagnosis. Then other we can do innovative and adaptive treatments which we discussed, and collaboration again. So these three are important points to develop standard breast cancer care programs.
Yes, actually, I think mentorship and technology actually bridges the gaps. Now, finally, doctor, for healthcare professionals listening to this podcast, what would be your top actionable recommendations to make breast cancer care more accessible to underserved population?
Yeah, so the top three actionable agenda should be, first should be the early detection. So detecting breast cancer early when the lump is very small is very important for very good patient outcomes.
True.
And obviously, if surgeons are there or physicians are there, then networking with the institutes which are offering standard breast cancer care and learn about that, so that the patients can be diagnosed early and referred early. That is again very important. So to develop that acumen, that a lump can be a breast cancer, and then patient should be referred. So that is, then again, third should be collaboration with all the stakeholders.
I think actually it is truly impactful takeaways, and I think the major role plays here is again early detection as well. So I think healthcare professionals should actually look out for those early detection methods and symptoms also. Doctor, thank you so much for sharing your expertise and insights on this, pressing issue today. So thank you so much for joining us today.
Thank you so much. Thank you for inviting me for this.
And I'm sure our listeners will take away valuable lessons to enhance breast cancer care in their community. So thank you so much to our audience for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay aware and take care of your health.